Are you one of those people who's turning 65, but you have health insurance either through your employer or your spouse's employer? For those of you who fall into this category, it can get really tricky. We're actually seeing more and more people working through 65 and having other health insurance. And it can be a really hard decision to decide whether to join Medicare, whether to leave the employer plan and join Medicare, or to simply stay on the employer plan. Now, one thing that I recommend, again, there's a lot of factors that go into this, but one thing I recommend is that you make sure that you do your research before you finalize your decision. So what that means is you need to look to see how much are you currently paying for your employer health insurance plan, and what will you be paying if you leave the program. So most of the time, for example, spouses of employers. So if your spouse is working for the employer providing you health insurance, if you come off the plan, your spouse's premium as well as deductible and out-of-pocket usually dramatically decrease. And if that's a situation, if you coming off of a spouse's plan decreases their premium, it can usually make sense to go to Medicare. Now, with that said, if you are the spouse having the health insurance and you have family members on your employer health insurance, it usually doesn't make sense for you to leave your employer plan, because if you leave your employer plan, then your family loses their insurance too. Now, I'm definitely oversimplifying this. There's a lot of calculations that go in to decide which is best for you, and it can have severe financial consequences. But I just want to highlight again to you that as you're making your decision when it comes to Medicare, please make sure that you're doing your research so that you won't regret your decision. Again, you have lots of options, which is fantastic, but please make sure that you're taking everything into account. And one quick warning, whatever you do, please do not overpay for insurance. What I mean by this is that we see people who are paying for their employer insurance, they're paying their premiums, but they're also paying for Medicare Part B. And usually, again, depending on what your employer plan details say, that would be overpaying. Most employers don't require you to be on Medicare Part B. However, there are some that do. But I hate when I see people wasting money when it comes to their health insurance and Medicare. So again, please make sure that you understand what your options are and you make the best decision for your unique situation. All right, here's to making Medicare easy.